Hey everyone, I'm Dr. Clint Steele, and I am going to talk to you a little bit about ChiroThin. I've been a chiropractor for 23 years, never really wanted to get into a weight loss arena of healthcare. I had struggled with it myself for years, but pretty much had it under control just through watching what I eat, exercise. I've always been an athlete. So never really had a weight problem that I couldn't handle by myself. And so a couple of years ago, I started noticing this accumulation of fat around the middle, and I decided I needed to do something about it. Kind of, haphazardly tried to attempt to take it off, but nothing really worked. Didn't get real serious about it until a good friend of mine had a massive heart attack. He was about my age, in good shape, went to the gym on a regular basis, was playing with his kids that morning out in the yard. That afternoon, boom, has a massive heart attack. And so it made me look at myself and think, what do I need to do to take this off? Like, it was kind of a scary moment for me. About 3 weeks later, I find out my mom needs to have triple bypass surgery because of the same thing. This weight around the middle that was accumulating that she couldn't take off. She walked 2 miles, 3 miles a day, ate fairly healthy, but that fat around the middle just accumulated. So I really had to get serious. I hired someone in Portland to I did a blood test. I paid a couple $1,000 for this guy to tell me what to do for 90 days. Basically, eating very healthy, just some very specific things that I needed to do for 90 days. And 90 days later, I lost like 7 pounds, but nothing around the middle. And 7 pounds in 3 months is not very much. We're talking like 2 pounds a month. Very discouraging. I also went on then also a 30-day detox. So it's not like I wasn't trying. It wasn't like I wasn't trying to eat healthy. Called a buddy of mine who was started a program called ChiroThin that was available only for chiropractors. And it focuses on what's called the HPA axis. Your HPA axis is your hypothalamus, your pituitary, and your adrenal glands. That's an axis that's supposed to work in conjunction with each other so that your body will let go of fat, will burn fat for energy. And especially we're talking about the disease fat, the white fat, the abnormal fat, the fat that accumulates around the middle that causes heart disease, causes a number of different health conditions. And so he told me about this program that he's been running for 5-6 years. About 70,000 people have gone through it. The average person loses about 24 to 25 pounds in 6 weeks. And most importantly, it was the abnormal fat that people were losing. So I said, you know what? Give it a shot. I'm going to give it a shot. The first week, I was very hesitant. I was very skeptical. I got on the scale. I didn't get on the scale for a full week after I started this program. And after that first week, I lost 10 pounds, and my jeans were already starting, and my pants were already starting to feel a lot looser. And so I was super excited. My goal was to lose 20 pounds around the middle. About 5 weeks in, I had reached my goal, and I stopped the program. Now I have a number of patients that are on the program. My mom's on the program. My brother's on the program. My fiance went on the program. So it's not like it's a program that I don't recommend to people that I care about, because I know it's very healthy. I know it's very effective, not only in weight loss, but also for health conditions. Now I have a number of patients that one lady, if you check our Facebook page, she did a video testimonial. She's been on 6 weeks. She was very super skeptical at the beginning. She said, I don't like eating some of these foods, and this is all healthy foods, fruits, vegetables, proteins, very healthy stuff that you're going to buy at the grocery store. No prepackaged foods, no high salt, high sodium. I've had people come in before that, they've been on Jenny Craig or something like that, and their blood pressure goes through the roof. They notice that they're retaining water because of the sodium levels in some of these foods. There's no prepackaged foods. There's no bars. There's no shakes. Nothing like that. So getting back to the story of my patient, she just visited with her doctor. 6 weeks later, she decided to go through the program, even though she was very skeptical at the beginning. 6 weeks later, she's down almost 20 pounds. 23 inches are gone. And in addition, she just met with her doctor. Her doctor told her her A1C, she's a diabetic, so her A1C level is so low that she's not diabetic anymore. She's a borderline diabetic, and she's probably in a few more weeks they're going to take her off her diabetes medication. And in addition, a couple other medications as well. I have people getting off their high blood pressure medications. This is a very healthy program. I wouldn't bring it into my practice if it wasn't. I wouldn't allow my mom to go on it, my brother to go on it, my fiance to go on it, and I certainly wouldn't go on it myself. Very healthy program, very quick, very fast weight loss. But then in addition, what we do now, I'm going on my second month now of maintenance, and I've been able to not only maintain the weight, but I've noticed now that I'm back into the gym working out, my results are a lot better than they were before as well. So I highly recommend you come in for an assessment. A lot of people ask me about, can I keep the weight off? Absolutely, but it's a lifestyle change, folks. When you first come in, we're going to sit down and talk to you and show you that, hey, you can lose this weight, but then you have to continue to eat healthy, okay? And so we continue to follow up with you to make sure you maintain those healthy eating habits, which again, foods you buy at the store, fruits, vegetables, protein sources, very healthy foods, anti-inflammatory, low glycemic foods. And in addition, then the program also entails a supplement that's made of amino acids and vitamins that allows you to metabolize fat, just helps you to maintain your lean muscle, those types of things. So again, very healthy program. A lot of people ask me about cost. We have 3 different programs that we offer. It's based on how much you need to lose, how much you want to lose, how much maintenance you're going to need after the program's done, but we break it down. If you want to pay in full, that's fine. If you want to pay weekly, we have very affordable weekly payment programs as well. So that's how we run the program. I would recommend coming in for a free assessment, free consult, absolutely no cost, takes about a half an hour. We will share with you the exact program, give you all the details, answer any questions you have, and if you want to get started, we can get started. So give us a call. Number is 207-240-4908. Again, 207-240-4908. Or you can check out our Facebook page as well, Chirothin of Maine. So Facebook/Chirothin of Maine. Or you can check out our website, www.chirothinofmaine.com. Hope to see you soon. Talk to you soon. Dr. Steele out.